I want to talk very briefly, and yet it's important, I think, about the Center for Disease Control. Our friend Michelle Malkin has a must-read piece at Real Clear Politics. She points out that the Center for Disease Control has been busying itself with an ever-widening array of non-disease control campaigns. And she gives some examples of why they are not ready to fight what they're supposed to fight. And I'm sure the news media will pick up on this immediately. Mandatory motorcycle helmet laws. CDC Director Dr. Thomas Frieden appoints a 15-member Community Preventative Services Task Force to promote pet nanny state projects. An obscure Obamacare rule stealthily increased the task force authority to study any policies, programs, processes, or activities designed to affect or otherwise affecting health at the population level. So last year, the meddling panel extended the agency's reach into transportation safety for the first time with a call to impose a federal universal motorcycle helmet law in the country. Is riding a Harley without a helmet a disease? Why is the CDC involved in this? Video games and TV violence. Again, at Obama's direction, in the wake of high-profile school shootings, the CDC scored $10 million last year to study violent video games and media images and to assess existing strategies for preventing gun violence and identifying the most pressing research questions with the greatest potential health impact, unquote. Whatever that means. Why is the CDC in gun control business? Playground equipment. The CDC's injury centers. Did you know they have 13 injury centers? Have crafted a national action plan and funded countless studies to prevent boo-boos and accidents on the nation's playgrounds. Apparently there aren't enough teachers, parents, local school districts, county and state regulators to police the slides and the seesaws. Why is the CDC disease control? Why is the CDC in this business? Social norming in our schools. The CDC has funded studies and campaigns promoting positive community norms and safe, stable, nurturing relationships in homes and schools. It's the mother of all government values clarifications programs. So bad attitudes are now a disease. Why is the CDC in this business? After every public health disaster, CDC bureaucrats play the money card while expanding their regulatory and research reach into anti-gun screeds, anti-smoking propaganda, anti-bullying lessons, gender inequity studies, and unlimited behavior modification programs that treat individual vices, that is, personal lifestyle choices, as germs to be eradicated. Here's a reminder, writes Malkin, of what the CDC does with money that's supposed to go to real disease control. In 2000, the agency essentially lied to Congress about how it spent $7.5 million earmarked each year since 1993 for research on the deadly hantavirus. Instead, apparently, without asking Congress, quote, the CDC spent much of the money on other programs the agency thought needed the funds more, wrote the Washington Post. Now, the diversions were impossible to trace because of shoddy CDC bookkeeping practices. The CDC also misspent $22.7 million appropriated for chronic fatigue syndrome, was investigated in 2001 for squandering $13 million on hepatitis C research. The CDC has its own private funding pipeline in the form of Friends of CDC, an Atlanta-based group of deep-pocketed companies, now including AT&T, Costco, GM, Google, IBM, Microsoft. The entity has raised some $400 million to support its work. Now, I would say too bad more that money didn't go to investigating Ebola. And we've talked about how they've spent some of their grant money on chimpanzees throwing poop and other very meritorious projects.